Hello, doctors. Again, welcome back to our 90-day University Prof Pre-Final Mastery Microbiology again. So we are here, general Microbiology Part 2. So today the class will be very small only because most of the topics we have already discussed here. So what we're going to do is, so general Microbiology 2. So here, this is the thing what we're going to discuss today. So the long answers, if you see here, the question asked is methods of sterilization. We have already did, general microbiology 1. The rest, all other questions, you see hypersensitivity reaction, antigen antibody reaction, and complement and hypersensitivity reaction. This is all done very well in our immunology class 1 to 3 class. Everything is covered very well. Yeah. So we're not going to waste time in the topics which you already covered. Instead, we'll go to the short answer, which is very important. The Louis Pasteur's postulates, whatever he found as a scientist. And capsule and flagella itself can be a long question or short, both are possible. Okay, it's not just short, they can be long question also. Autoclave, though we spoke yesterday, we can do one more time, not a problem. Sterilization and the enrichment media, also we talked about different media, but again specifically we'll talk about enrichment media. So the class is going to be small only. Okay, so once again, in Auricle, this is the reasons why you have to choose Auricle, because of all the recorded classes we have, all your live classes, practical session, exam module, and hard copy sets we have, right? So next, then here, these were recorded classes, the very good flexible learning, expert instructions, and convenient revision is the reason why you have to go through this. And then we have live class sessions, which is going on now. And then we have an express exam module also, which will be very important for writing, to improve your writing skills for exam. And one-to-one doubt clearing session is also very important, that it will really help you a lot to clear your exam very well. And then hard copy notes you will get, definitely. And then the question bank is also available with so many number of questions, which will be very, very useful for your upcoming exams. And then practical sessions also, it's going to be very, very helpful and nice. And these are the different type of plans we have: foundation plan, advanced learning, complete learning, and ultimate MBBS plan. So you can choose whatever suits you and make good use of everything. You can use this Dr. Santhosh Raj, my name, for discount. Okay, that's all. So now we'll go to our topics. So the first question at all, Louis Pasteur. Louis Pasteur, this is a short note only. Definitely, this will be a short note question only. No one more question they can ask. So since starting, this is Louis Pasteur means is father of microbiology, right? The father of microbiology, not the modern microbiology. If they ask question father of medical microbiology or modern microbiology, that would be Robert Koch. Okay, but here Louis Pasteur, father of microbiology. So what are things did he found? What are things he contribute in microbiology? Means first thing he gives this germ theory. He is the one who proposed the germ theory, number one. Okay. Then he invented three important vaccines. What are those vaccines? Okay. That's very important. The shortcut for vaccines you can remember as you can remember CAR, C-A-R, CAR. Okay. So what are they? One is your cholera vaccine, and A is for your anthrax vaccine, and R for your rabies. These are the three vaccines he invented. Okay, fine. Right. But then the person who invented vaccine first is Edward Jenner, smallpox. Okay, that's a different thing. Here, our Louis Pasteur invented these vaccines. Okay. So now, what else? Another very important thing is that he invented the sterilization. All sterilization. That means it includes your autoclave, hot air, most important ones: autoclave, hot air oven. If you remember pasteurization also, hot air oven, pasteurization techniques. He is the one who gave idea for all these things. Sterilization means it's him only. Okay. And then another important thing is that he is the one who gave idea of liquid media concept. Liquid media to grow the bacteria. He is the one to grow bacteria. So he is the one who gave idea of that. Okay. So these are the points. So 5 points, 5 marks easily you'll get it if it's a 5-mark question, or even a 2-mark, whatever, how are they going to ask you? Okay. That's all. So these are this invention. Okay. So we are going to skip this one now. So you go to next slide. This is the picture. Everything is mentioned here. Whatever things he has found, it's very clearly given here. Okay, that's all. Now, next. A capsule. A capsule is a 5-mark, or it could be a long question also. Okay, so we will prepare for both. So when we talk about a capsule, first of all, capsule is for protection, right? So basically, in the first initial point, what you're going to write about capsule is basically glycocalyx layer. It's a glycocalyx layer. When it is compact, you call it as capsule. Glycocalyx layer, when it is compact, it's capsule. But if the glycocalyx is loose, we call it as a slime layer. So slime layer also, it comes under capsule only, but it will be a little bit slimy. That's it. Okay, that's the glycocalyx layer is loose. That's all. Now, what is the function? What is the function? The function, the main function of this is the antiphagocytosis. Antiphagocytosis. So bacteria, this capsule prevents the antiphagocytosis, and because of antiphagocytosis, the bacteria can cause increased risk of infection. This is the function. Now the structure. When you talk about the structure, we already told it's a glycocalyx layer and everything we told, but usually when you talk about the structure, it is made up of, what? It is usually made of polysaccharide, means sugars, polysaccharide. Okay, most capsule. Exception. One exception which can be asked in your 1 mark question also, that is your, I'm going to write it here now. Exception is your Bacillus anthracis, you call Bacillus anthracis, which is made up of polypeptide. Because you have amino acid AA, so A for anthrax. So that's what. Okay. So it's made up of polypeptide amino acid. That's just made up of polysaccharide. Usually, this is the only one which is made up of polypeptide, exception. Now there are the examples. Now the next would be the examples. Now we'll talk about the example. So we're going to the next slide, or I can write it here also. Yeah, we'll write the example and then go to the next one. Yeah. Example. See, example of it, there's so many ways to remember. One easy way is, right, so remember some pretty killer bacteria, have nice capsule. They have very nice capsule. Some pretty killer bacteria have nice capsule. Simple. Okay. So now what are the things you're going to remember here? This stands for Streptococcus pneumoniae. Streptococcus pneumoniae. P stands for Pseudomonas. Pseudomonas, mostly it has the your slime layer, but you can add in capsule, not problem. K for Klebsiella. B for, it is your Bacillus anthrax. We already spoke now. It's only polypeptide one. H for Haemophilus influenza. Haemophilus influenza. It's a shortcut I'm saying. You don't have to write this some pretty and all. You have to write this bacteria name. This is important. 1 mark question also they will ask. Okay, this also they'll ask. Important. And nice for Neisseria. Neisseria meningitis. 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 Okay, you know that one. C for Cryptococcus. Cryptococcus neoformans. This is the only fungi. This is the only fungi that has having capsule. There are other things also, but mainly remember this Cryptococcus only. Okay, that's all. So now we finished with this one. Now next would be we're going to the diagnostic. How to diagnose a capsule. Okay, so how to diagnose a capsule. For that, usually the first one that is your negative stain. We use negative stain. Negative stain is basically India ink. Nigrosin. India ink and nigrosin, both are negative. Indian and Nigerian negative. Remember like that. Okay, negative stain. Then we have something called Kulling's reaction. Kulling's reaction is basically when you add anti-capsular antibody, there will be swelling of the capsule. Swelling of capsule. This is for all capsule. Okay, every capsule. But there is something called Kulling's reaction, negative stain, and something called McFadden's reaction. McFadden's reaction is commonly asked question, McFadden's reaction. So how to remember this McFadden reaction is, it is for only your Bacillus anthrax. It is for Bacillus anthracis. Okay, only for Bacillus anthracis. Now what happens is that you add a methylene, you add methylene blue stain, then there will be swelling of the color, the capsule. It's actually not the word swelling. I would say the capsule gets, the capsule gets purple color, becomes purple color. Okay, capsule becomes purple. That's all. This is McFadden interaction. So these are the three important things: negative stain, Quilling's reaction, McFadden's. Of course, you can use dark field microscopy, dark or phase contrast you can use, but better is this only. These are the most common one where to identify the capsule we can use. Okay, that's all. To identify the capsule, these are the best ways. That's all. These are the important diagnostic methods to identify. These three you have to remember. Okay, that's all. This is the most important thing in a capsule. Finished. If you write this more than enough, okay, you'll get all good score you'll get. So you can see everything is mentioned here. Yeah, okay, you would have added this picture also. You can draw a picture like this and write it also. Okay, so everything is mentioned here. And organisms are given. All yes, one more we forgot. Latex agglutination test also we can do. I forgot to tell you. Latex agglutination test is also one of the good way to do this one. Okay, that also please remember that. That's all. So everything is mentioned. So now we are going to the next question. Flagella. When you talk about the flagella, flagella, when you talk flagella, you have to say flagella. The main thing for flagella is use of flagella is for motility. Flagella is for motility of the bacteria, right? It is for the motility of bacteria. Types. So next is your types. When you talk about types of flagella, you have two things. We have exoflagella and endoflagella. We have exoflagella, most common type, and the endoflagella. Endoflagella. Endoflagella, exoflagella. Now you have to give the example. Endoflagella means the flagella is inside the bacteria. So you draw a bacteria like this. This is a spirochetes, and there will be flagella inside, endoflagella. So example is spirochetes. You have to give spirochetes. Spirochetes bacteria. Okay, spirochetes and you have Treponema pallidum, Borrelia, and Leptospira, endoflagella. Exoflagella, if you're writing, there are different types. So we are going to write it here. It can be unipolar. You have to draw the picture. Always it's better unipolar, or it can be unipolar one only. Okay, unipolar, unitrichous. You can say it as better trait monotrichous. Monotrichous, unipolar, one side only. Okay, monotrichous. And we have peritrichous. Peritrichous means the name says. So you have flagella all around. You have to draw the picture. Okay, all around. And then we have lophotrichous. Lophotrichous. Lophotrichous means only at one side you have lot of flagella, right? Lopho. And then we have the amphitrichous. Amphitrichous means both the end. You can have the flagella in the both the end, amphi, two sides. Okay, I'll continue. So for everything you have to give an example. They are important. Unipolar, you always go with Vibrio. Vibrio, okay, Vibrio cholera. And also Pseudomonas. Vibrio and Pseudomonas, they are mono. Peritrichous, most of them. Example, classic example, you can have E. coli and Proteus is enough. Okay, remember. That's enough. Salmonella also. Lophotrichous, you are going to give H. pylori is classic example. You Campylobacter also, but better is H. pylori is more common. Okay, Amphitrichus, you give alkaligens. Alkaligens, not much asked. You can write it. That's all. This is the types of flagella. We have exoflagella and endoflagella. Now, these are given. Now types of motility is very important. They ask you always types of motility. When you talk about the types of the motility, you are when you talk about the types of motility, what are the types of motility we know? We know that commonly asked question is, you know that they are swarming. At least 4 or 5 motility you have read example, commonly asked question. Okay, one more question. So darting motility, there is tumbling motility, gliding, swarming, tumbling, gliding, corkscrew, and falling leaf. There are so many, but these are the most important one. At least for few examples, you must give these examples. Okay. Now, swarming is in Proteus, classic. Darting, your cholera, Vibrio cholera, right? Vibrio cholera, okay, tumbling, listeria, gliding, your mycoplasma, corkscrew would be your spirochetes, falling leaf, it's falling. So what is falling? Giardia. That's it. These are the things, okay? Types of motility, these are the types of motility. Now, diagnostic, excuse. So, diagnosing the motility. How do you diagnose the motility? So, for that, let's start the names are wet mount. Just you have to make a slide, and then you add a you mix this bacteria with the peptone broth, and then put a drop and put a slide, cover slip, and see it. Or you do hanging drop also, like it's like wet mount only, but you're properly seeing, you're tilting the drop like this, you're hanging it like this opposite. So you're seeing the motility by hanging drop method. And then we have also semi-solid. You if it is able to move in the semi-solid agar, which is 0.2% agar, then that is also one possibility. Easy to get it. Other one is a special stain we have. If you want to check for the special stain, you have to use the stain name is tannic acid staining. For flagella, it is tannic acid. Also, we call Leifson and Ryu stain, Leifson Ryu stain. Okay, these are the one, tannic, Leifson, Ryu stain. These are the stains we can use. Okay, then last one would be you can use dark field here, especially for your endoflagella. This is very good. Dark field microscopy, dark field or phase contrast. You can see it. That's all. These are the flagella points. So if you're going to write these 2 points, it's more than enough. You will really, exams will be happy with this. That's all. Okay. Now, next. Next is your this flagella. Everything is given. You can see the picture also here mentioned. I have all the motilities are mentioned here, but the important one, what I told you to remember, but these are other bacteria. So go through it once. Then autoclave. So autoclave is very simple. I'm not going to stress again. Only again, I'll take a short revision we can do. The basic point is temperature. Autoclave means temperature. You should know for autoclave sterilization. We use it for sterilization. Now temperature. The things you have to remember is the temperature and the articles which we are sterilizing, and then the control. These are the things you have to do, and then to draw the picture. Picture I will show you. We draw it last time also. Picture also I'll show you. You can do that picture. Okay. So here, what are things? Temperature you know very well. 121 degrees Celsius for 15 minutes. 15 PSC pressure, right? This is a common one. There are a little bit variation, but this is the most commonly used is this much only. Articles, if you see, all the culture medias. Microbiology, whatever culture media is there, we are sterilizing with autoclave. Number two, also non-sharp surgical instrument. Sharp ones you put in hotclave, non-sharp surgical instrument. Articles, non-stop surgical instrument one. All the plastics and rubbers. Rubber, all these things. Okay, so whichever all the plastic, because plastics and all you can't put in hot air, it will be gone. So all the plastic, your gloves, tube, whatever comes, if you want to sterilize, you have to put it here only. Okay, even before sending it for incineration, also you have to use hot air, autoclave. In autoclave only, we have to sterilize it and then send it for incineration. Now, control. When you talk about control, you know that is the bacteria which we use is the Bacillus thermophilus spores we are using. Yes, okay. Now look at the picture. Now this is the picture. If you see temperature variation can be 126, 132 also we can use. Okay, that's all. Culture median we told, everything told. And look at this. So you draw this picture. There's a pressure gauge. Then there's a safety valve. And this is the body with the jacket. This is a stand. So bucket, here all the items are kept here. Whatever the things you want to sterilize, plates, culture media, whatever, you have to put it here only. So here it gets sterilized. Okay. That's all. This is for the, it's a type of moist heat. Autoclave is a type of moist heat. So this much is enough, more than enough for your autoclave. Okay. Now, next. enrichment media. Enrichment media already we spoke, but again, once again, we can go. Nothing is wrong. You need to learn it once again. So here, what happened in enrichment media? And when you talk about the definition, enrichment is the media where it enhances growth of pathogen, inhibits growth of commensals, unwanted bacteria. Okay, the bacteria which is not that dangerous or no useless for us. It enhances only the growth of pathogen. That is the enrichment media. Now Now you have to give the example. Definition is very important. Then you have to give the example. We talk about the example. Commonly used one is the alkaline peptone water. Alkaline peptone water, and other one is your selenite have broth, and one more tetracyanate have broth. Okay. Now alkaline peptone water, classic example for your Vibrio. For Vibrio cholera, to enrich it, to make it, because stool contains lot of other bacteria also. So you have to inhibit all other commensal and only pathogen to isolate. You're using alkaline peptone water. For Salmonella and Shigella, we are using this Salmonella and Shigella. We are using selenite here broth. Both the broth will be enrichment for. Okay, that's all. Just two enough for the example and short enough. This should be two more questions. Sometimes five also. You can not a big deal. You can add. Okay. So that's all. This is about our enrichment media maximum. So that's all for today's topic. So only one more class of general BBB, then this much is more than you will be able to answer all the questions easily. Okay, maximum is covered. Actually, first class itself, general microbiology 1 itself, we have covered maximum. So these are like now revisions only for you. Okay, so that's all. Thank you so much. We'll see you in the next class soon.